Well, good afternoon, everyone. My name is Maura Healy, and I am so happy to be here today in Quincy with all of the wonderful folks behind me. We're here to make an important announcement because it's a program that we're launching out of the Attorney General's office that I believe is going to help us fight opioid addiction and, more importantly, help prevent opioid addiction in this state. Joining me here today is our wonderful mayor here in Quincy, Tom Koch. Thank you so much for being here, Mr. Mayor. Norfolk County District Attorney, Michael Morrissey. Founder of Learn to Cope, Joanne Peterson. And I'm especially pleased to be joined by a wonderful group of seniors from North Quincy High, go Red Raiders. Right. Abby Koch, who is president of the Students Against Destructive Decisions, and her other chapter officers, Nicole Flora, vice president, Shannon Kennedy, treasurer, Vivian Tran, treasurer, Shannon Kennedy, secretary. All right, thank you guys so much for being here today. We're also really pleased to be joined by Quincy Police Department Captain DeBona. Thank you very much for being here, sir. As well as your wonderful elected officials from this area, Senator John Keenan and Representative Bruce Ayers. Thank you for being here, and thank you, both of you, for your commitment and your leadership on the issue of addressing and combating opioid addiction. Now, I also want to take a moment to acknowledge Marianne Frangoulis from Moore, who is also here and a great partner in this effort as well. And of course, Coach Bergoli of the Red Raiders girls basketball team, you know I love that, who is here with us as well. Look, everyone in this room knows the toll that heroin and opioids and prescription pills have taken on our communities, on our families, how many lives have been ruined. And it's a story that we continue to see play out here in the news. But for the last several years, two folks have been on the front lines fighting this before others even joined in the fight. And specifically, I'm talking about Mayor Koch, who beginning in 2008, was leading a substance abuse task force and really led the way in 2009 when he made sure that each and every Quincy police officer was carrying Narcan. And that's terrific leadership, and we thank you for that, Mr. Mayor. Another terrific leader who has been on the front of this crisis for a long time now is your district attorney, Michael Morrissey. Among many other things, DA Morrissey was the first district attorney in the Commonwealth to offer naloxone training and doses to all of the police and fire departments in his district. He was also the first district attorney to finance prescription drug take-back containers for police stations across this county, and he has provided school-based prevention efforts for a long time, as well as community workshops. I especially appreciate the fact that he is the only DA that I know of who actually has a pharmacist on his staff, and he's been keenly focused on the issues of problematic prescribing practices. We are here today because we have an epidemic on our hands. Last year alone in the state of Massachusetts, over 1,700 people died from fatal opioid overdoses. This year, folks, the number is going to be even higher. We expect to see over 2,000 opioid deaths before this year is out. We know that over the last 10 or 15 years, the number of fatal opiate-related overdoses in Massachusetts has increased by 400%. And today, as we gather, 5 people in Massachusetts will die as a result of opioid addiction. 5 people each day in our state. Over the last year, we've moved and we've seen that not only it's pills out there that are a problem, it's also heroin. And now, increasingly, it's fentanyl. So far, for 2016 alone, 70% of those fatal overdoses are linked to fentanyl. It's why my office moved over a year ago to make the trafficking of fentanyl a crime here in the state, and I thank the members of the legislature for criminalizing the trafficking of fentanyl, but increasingly, that's what we're seeing. Now, we know our young people are particularly susceptible to the risks of substance use. 90% of adults who are struggling with addiction started using when they were under the age of 18, and 50% were under the age of 15. I recently met with one woman who started experimenting, partying with Percocet when she was 16 years old. There was Percocet and Oxy and some Vicodin going around her high school. She figured that taking a pill was safe because doctors said these pills were safe. By the time she turned 18, a matter of 2 mere years, she found herself living in a rooming house with no one to help her. She dropped out of high school, she had no family, she had nothing. All because of a prescription painkiller addiction. What had started out for her, like many students, something to try for fun, something to experiment with, turned into a really, really devastating course. Now, the good news is for her is that she's now at Boston University and she is studying health, and she's interested in majoring in psychology and working specifically to help young people with addiction. So that's good news, and we need more success stories like that one. But even more than success stories like that one, we need to do everything we can to prevent this from happening in the first place. And that's what today is about. We know that effective substance use prevention programming can significantly reduce the risk for addiction among young people. And that's why we're here today. So let me tell you a little something about how this came to be. You know that my office has been at this for a while, working on a number of fronts to address this issue. We're going after drug traffickers who are pumping pills and heroin and fentanyl into our communities. We're working with the medical community to educate doctors and prescribers on safe prescribing practices. We're also holding accountable doctors and others who aren't engaging in safe prescribing practices in a way that endangers the public. And we're spending a lot of time and resources to help break down barriers that keep folks from being able to effectively access treatment, which is such a vital part of this recovery process. We know this is an issue that affects all communities, folks from all walks of life, and we know we need to continue to press on intervention and treatment as well as law enforcement. But today, I firmly believe that for us to move forward as a state and to see those numbers change, we need to do a lot more when it comes to education and prevention, specifically education and prevention for young people in schools. Now, a little while back, my office announced that we had reached a settlement agreement with CVS, which is the state's largest pharmacy chain. There are 350 CVSs in the state, employing over 1,200 pharmacists. And the good news is that we were able to secure a first-of-its-kind agreement with CVS, where their pharmacists are now going to check the prescription drug monitoring program database before they give out certain opioid prescriptions. That's a good thing. We want doctors to check. We also want those dispensing to check. The other thing that CVS did is they agreed to contribute $500,000, $500,000 to a grant program that my office is announcing today. We're calling this the Youth Opioid Prevention Grant. That money is going to be used to fund school-based education and training for young people across the state. Now, we know that schools are required to do this programming, but unfortunately, many lack the resources to be able to deliver and get that done. We know the wonderful work you're going to hear about happening at North Quincy High, but so many schools across the state don't have the resources to deliver the kinds of education and training that our students and that parents need. But with this grant money, we're going to start to fund programs to get to people at a young age, to help them start making the right choices, to help them take the right path. Now, I'm hoping that we see grant applications come in from schools across this state and other organizations that want to implement this prevention-based curriculum. This includes nonprofits, public schools and school districts, community organizations, health providers, youth organizations, cities, towns, and law enforcement agencies. All are entitled to apply for these funds and are encouraged to send their ideas and their proposals for how to deliver education to address issues of opioid dependence and addiction. I've just heard way too many stories from way too many people whose lives have been ruined. Parents who've quit work, taken time off from work to care for a loved one, family members who sit worried every day for that phone call to come, wondering what's actually going to happen to their loved one. The young people who were prescribed opioids for sports injuries or for wisdom teeth removal that in no short amount of time found themselves down the road to serious addiction. This is a problem where I think we have a moral imperative to act as a state, and we certainly have a moral imperative to do as much as we can for our young people. While we work on getting people access to treatment, supporting efforts at recovery, and clamping down on some of the prescribing dispensing practices as well as the trafficking of illegal drugs in our state, we also need to focus as much attention on the front end. That's what today is about. Early education, prevention efforts, equipping these young people to be their best selves and to be as healthy as they can be. So I'm proud to be able to stand here in partnership. I'm proud that our office is going to be using this money to fund these programs, and I look forward to the good things to come for the sake of young people and families across this state. At this time, I'd like to welcome to the podium Mayor Koch.
Well, first of all, thank you to our Attorney General, Madam Attorney General Maura Healey, who from the day she was sworn in has made this issue a #1 priority as far as the Attorney General's office. So her leadership has been so important on this issue. And those that have been in the trenches for many, many years understand the frustration it is. And the more tools, the more resources, and the more folks we can bring together on this, the more successful we'll be. And I know Joanne would agree with me, and success is hard to measure on this issue. But every child, young person we keep away from it, though we can't measure it, we are succeeding. So I want to thank the Attorney General. She was here not too long ago, as she said, on the domestic violence. I was with her last night in Boston. She was a speaker at an event at the Renaissance. Seen her quite a bit crisscrossing the state. She brings tremendous energy. And what I also liked, I know in the city, speak locally, we've been really focused on the addict and the treatment, as we should, education. She hasn't lost sight of the enforcement part, that there are bad people out there putting this stuff in our kids' hands that have to be dealt with. So as Attorney General, of course, she carries a big stick. So we're grateful for that effort as well. I see Senator John Keenan here. I've known the senator. In fact, he's a North Quincy High grad, also played basketball. I don't think he was as talented as you, Mara, but when he got his committee assignment at the State House, he rolled up his sleeves immediately, and working with Bruce Ayers and his colleagues in the legislature, got some incredible legislation passed, holding the medical community more accountable on prescription. So we're grateful for that. The district attorney, another North Quincy High grad. You didn't play basketball, did you?
I was a manager.
He was the manager of the basketball team. We used to call that the water boy, but no offense.
We were 20 when I got to go to Bermuda, so it didn't matter.
But the DA, the minute he took office in his new role, he was state senator, state rep before that, rolled up his sleeve and bringing the county together, all the different cities and towns in the county, and again, bringing resources, bringing people together to kind of unite the effort, because we can't do it individually. We've got to do it as a team. I do want to acknowledge some people at the local level here at the city, and certainly our superintendent of schools is here, who's a tremendous leader for the school system, and he's got a great team, including Maura Papil, who's directly involved in our task force on behalf of the superintendent, does incredible work. Kristen, remarkable. I mean, I hear about the kids at North Quincy all the time, the job you do at North, the leadership you provided, and of course I know you're supported by your principal, Mr. Rob Shaw, each and every day, another North Quincy High grad. And then most recently, with all the things that we've been doing locally, and Larry Liuzzo from my office has been the key person for me up until for the first time in our city's history, we've hired somebody full-time to focus on this issue, and that's Laura Martin, who used to work with the district attorney, but I stole her. I'm paying her more than he did. And we're just thrilled to have Laura on board as we continue to work this issue to make a difference in our families' lives. So thank you all very much. Thank you to our Attorney General for this new program, and hopefully we'll continue to work together with the resources and start to turn that tide so the numbers are going the other direction. So thank you.
Terrific. Thanks so much, Mr. Mayor. Thank you, Mr. Mayor, and thank you for the collective and powerful commitment from all within the city joining forces to take this issue on. And now we're going to hear from our District Attorney, Michael Morrissey.
Thank you. Thank you, Madam Attorney General. Should point out to my good friend Bruce Ayers went to North Quincy, with all due respect, Mr. Superintendent. And Larry, you're a grad as well, are you not? So not that we're biased or anything. I was always brought up in a household to root for Quincy High, except when they play North. It's that simple. So Thanksgiving should be interesting. As I look around the room, I see a lot of people who we do a lot of great work with and community partners. Joanne Peterson was one of my first. That she has grown from a small group to, have you hit 30 yet?
24.
So it started one little chapter, and it's now spread out across multiple states of families in crisis. And she was one of the people who actually taught me a lot about when I didn't know as much 6 years ago, but I did know that we are not ground zero for the opioid epidemic here in Norfolk County, although some days it does feel like it. That we lose 3 people every week to opiates, and that hasn't changed. In fact, as the Attorney General mentioned, that we're going to be higher this year statewide. In the short time I've been the district attorney, 500 people have died of more than 500 people of opiate deaths. We lose a person a week in a car accident, and a high percentage of those are drugs and alcohol related. And so we've had 6 homicides this year. We don't have many homicides. What is killing people in Norfolk County, one of the more affluent counties in the Commonwealth, are access to drugs. And I do have great community partners. The police departments in Norfolk County, particularly Quincy Police, had been a leader in naloxone and drug take-back. They're one of the first ones. They do arrest a lot of people. They work closely with the 5 state troopers that we have. We cannot arrest our way out of this problem. We do a ton of work in trying to put tools in the hands of local people and local groups. And the mayor mentioned my friends in the legislature, they get it. John, when he came and he got his first assignment as chairman of the Committee on Mental Health and Substance Abuse, if you ask me, it wouldn't have been my first choice, but honestly, at that time when John got it, it was probably one of the higher profiles committee you could get. And I told him he was right on ground zero and trying to help solve the problem. And so I couldn't think of a better person to have been the chairman of that committee, and has done some good things. When we have a death, and we work closely with the local police departments, we treat it like a crime scene. We go out and we have to determine whether it's accidental or homicide. And so we gather a lot of information from that, and out of that we've been able to determine trends in some of the things that we see. We're sending people out now and doing community education to families where there is a save, and I couldn't even give you the numbers of how many saves. I can give you the deaths because they cross my desk at least 3 times a week. When we save a family, we're now trying to put more information in the hands of those families. We have a retired fire chief who goes out and talks to them and tells them about opportunities for them either to meet with Learn to Cope or other groups where they can get help and assistance. And having a pharmacist on staff, we have referred doctors and pharmacies to the boards of registration for what we consider not crimes, but what would be failures, I think, standards of care that they should be providing. And young people, sorry to say, I think the only way that they will and are going to be in the trenches, there's so many choices for young people that they can make these days that weren't available to us. Oxys came on the market in 1997 as a non-addictive pain medication. And I know that people put a lot of faith in the medical community, but we see so many children even that have serious sports injuries that are prescribed a medication, a pain medication, if used appropriately and following advice of a doctor. But simple abuse can send people down that spiral that lead them to the cheapest drug on the street is still heroin at $5 a bag, except when Mr. Bergoli was younger and I was younger, it was only 35% pure in the 60s and 70s, and now it's upwards of 75% pure, and it's cut with fentanyl and other dangerous drugs. So the chances of an overdose are growing each day. And so if a lot of children think that it's safe to take a pill because some doctor prescribed it, and we have to get the message out to people. I know these are high school kids, and it may even be down into the middle schools and lower grades about the danger of medications and taking medications that are not prescribed for you. 70% of young children get their first experience taking a pain medication out of your and my medicine cabinet. So that's where we have to start and really put a lot of emphasis in. The Attorney General is absolutely right. We're not going to arrest our way out of this, but we can through prevention and education. I'm happy to see that she's partnered with CVS because there's a lot of work we can do. I was fortunate this weekend to have 250 kids from across the county, student leaders. A couple of them were there with Kristen. Took a Sunday off, Mr. Superintendent. I'm sure you'll owe her for that. And don't laugh too hard, Kristen. So it just he had some what I consider some really good kids. You know, I keep telling him the behavior of good kids can be contagious, and that if you can be a leader when you see something going wrong, and you're going to hear from some of them today. And I think having not forgetting the good kids is important to send the right message. And I think I applaud the Attorney General for this good work, and I think this will go a long way, especially in our schools. We need more help, and I know that Superintendent is putting some resources with the help of the school committee. So thank you, Attorney General. We hope this is going to be a success, and I'm sure we're applying. So
We'll get both North Quincy and Quincy. Now I'd like to welcome Joanne Peterson, who started Learn to Cope, and as the district attorney mentioned, it's been an organization that has grown throughout this state, been a terrific resource. I've had the benefit of going to many Learn to Cope meetings, and Joanne, thank you for all that you do.
Thank you. Thank you, Attorney General Haley and Mayor Koch, and of course, District Attorney Morrissey and the young students here. And many people in the room, too many to name, but Mary Ann, who I've known for many years and learned so much from, Senator Keenan, everyone in this room is a big part of the solution. And we have our work ahead, and it's getting harder by the year. So Learn to Cope started 12 years ago. And unfortunately, we've had to grow, and we continue to grow. And unfortunately, this past year is the worst year I've ever seen. We've lost more people from our groups around the state than any other year. Our office is very difficult some days. Some days we get 2 and 3 calls about deaths from within our groups, or from somebody that just lost someone that's never been to our group and now wants to come. It's really hard for our staff some days. One of the young girls that works with Learn to Cope, she's a millennial. She came to me right from Stonehill College. She's lost 30 people that she grew up with in Rockland. 30. And not just this past year, years past, but that is frightening. We have our work ahead, and we just, as you all know, marijuana is now going to be legal. Many of our parents that come to our meetings, their kids started in middle school and high school with marijuana and alcohol. Now it's going to be freely available as long as you're 18. And, you know, there's kids that will experiment and, you know, go to drinking and then maybe go to pills and then maybe go to heroin. I'm not saying that everybody that uses marijuana ends up addicted to something, but certainly this is a bad time for us in the work that we do. So I am really excited about this grant because, and I've been saying for 12 years, this needs to be in science class. Science teachers need to be teaching young children about their brain, and I don't mean the frying pan with the 2 eggs in it. I mean the science of their brain and what happens when you start putting a substance in your body that doesn't belong there. So I am so elated about this, and I hope the communities and organizations that apply for it will team up with experts, somebody maybe by the likes of John Kelly from Mass General Arms Program, or, you know, the Recovery Research Institute. He's renowned. There's many others, you know, NIDA, many other places that can really help science teachers and prevention teachers put together really solid curriculums that aren't just saying don't do drugs, or, you know, if you do this, this will happen, if you do that, that will happen. I mean real science. You know, we're not doing the young people any favors by being afraid to talk about the things that are happening, that many of the siblings in the schools are losing their brothers and sisters, or they're coming to school and people might wonder why they're so tired. They might have been up all night hearing their parents crying because their sister's missing or out being trafficked somewhere. So the kids in the schools might not even be telling you what they're going through. So we have a lot of work ahead. Unfortunately, it's getting worse by the day as far as the opiates, although there's so much work being done, and I'm so grateful about the fentanyl laws. Almost all of our deaths lately, when the parents get the medical examiner's paperwork back, it says fentanyl. So as much information that can be given to these children in a safe manner in a scientific manner with experts to help the coalitions and the organizations that will be using this information, I think it could make a huge difference and maybe turn the tide on this epidemic. So again, I'm really honored to be here and be able to use my voice, and it's my voice. I'm using this for many voices, you know, some in this room and across the state. You know, I'm a parent, and I'm just fortunate I still have my family intact, but a lot of my friends do not. So I thank you and everybody here, and especially the young students, for the work that they're doing. They can be the change, the millennials and the younger ones now. They can be the ones that end up out in the career, you know, out in the career world, becoming nurses or, you know, doctors or teachers. They're going to know a lot more than we didn't have the chance to. So it gives me hope every time I see young people involved. Thank you.
And now I'd like to welcome forward Abby Koch, who is not here as a relative of the mayor, but is here as the president of the Students Against Destructive Decision-Making at North Quincy High School. You should know that this is a incredible chapter here at North Quincy High. In fact, they were just recognized with a national award of all the chapters in the country. They came in second and got this award in recognition of the amazing work that they're doing. So congratulations to Nurse Houlihan and to the wonderful students here. Abby's going to come up and say a few words, and she'll be joined again by Nicole, Shannon, and Vivian, who are part of the chapter as well.
The SAD chapter started at North Quincy High School 9 years ago, has grown from just a few first initial members to over 200 student members. Our chapter relies on peer-to-peer education, and our advisors and administration give us a voice and listen to our concerns. As a group, every year we offer prevention programs that provide examples of the dangers of using drugs and alcohol at such an early age. We partner with state and local agencies and also with local residents, all whom share their stories and expertise and provide us with the knowledge to make better choices when out with our friends. As a senior in high school and a 4-year member of SAD, I can say that the programs and education I have received as a part of this group and as a student at a school that supports such programming has given me the knowledge to make smart decisions when out with my friends. These opportunities have been made available because of grants, private donations from our community, and the financial support of our school system and city. Today's announcement of the Youth Opioid Prevention Grant and the opportunity to apply for this funding represents an amazing opportunity for all local communities. As a student who has benefited from prevention programming, I am honored to be a part of today's program. I credit what I have learned during my 4 years in a school system that recognizes the importance of prevention programming to helping me make healthy decisions. Thank you to Attorney General Healy and everyone here today for your belief in the education I credit to keeping me and my friends secure in our decision to remain substance-free. And we would also like to thank our nurse, Kristen Houlihan, for all her hard work.
Well, thank you so much, Abby. At this time, we'll open this up for any questions.